Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of my clients, and the question in the last episode was why you should avoid long-term acute care, also known as LTAC, or subacute care when your loved one is critically ill in intensive care, ventilated. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to continue answering the next questions regarding James and Christine's dad in ICU who's had a hemorrhagic stroke. James and Christine's dad had a brain decompression where they evacuated a large bleed from his brain after the hemorrhagic stroke. James and his sister Christine were getting their dad in one of the best hospitals in the United States, the Cleveland Clinic in Ohio. In the meantime, their dad was getting a tracheostomy because he couldn't be weaned off the ventilator and the breathing tube. He also had ongoing seizures due to the stroke, and his anti-seizure medications needed to be optimized so he could actually wake up and progress to neurology rehabilitation. So in today's episode of Your Questions Answered, I'm talking to James' sister Christine again, who also has questions regarding her dad's situation, especially with a view of the Cleveland Clinic wanting to move her dad to a long-term acute care facility. Christine wants to know what's the best course of action, and I can show her proven strategies how to keep her dad in a safe intensive care environment. You will see in today's episode why anybody on a ventilator with a tracheostomy should stay in ICU or go home with intensive care at home services, rather than going to LTAC or long-term acute care, or even worse, subacute care. So today's consulting and advocacy session is another excerpt from a one-on-one phone and email consulting and advocacy session with me, and the topic this week as part of this one-on-one consulting and advocacy series with James and Christine. And the title of today's episode is Proven Strategies: How to keep your loved one ventilated with tracheostomy in ICU rather than going to LTAC or subacute care. So, if you're watching this on YouTube, just click on the link below this video and that'll get you to our website where you can read the dialogue. And if you are on our website, just scroll below this video and you can read the consulting and advocacy session between me and Christine, and you'll get all the insights there in how you can keep your loved one in intensive care if the ICU team has suggested to go to LTAC or subacute care. I would highly recommend not to go there in the first place. And again, in this episode today, you can get proven strategies in how to achieve that. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? Well, you get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I will see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. Or you can call me, find international phone numbers on the top of the website, and also have a look at our ebook section. And you can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.